For nearly 40 years, Tranquility has provided real-life protection for people with incontinence. Our high-quality products help you manage loss of bladder and bowel control with comfort, confidence, and dignity. Choose from disposable briefs, pull-on underwear, booster pads, and more in a wide range of sizes from youth to 5XL. Request free samples today so you can experience the Tranquility difference for yourself. Go to tranquilityproducts.com to take a survey for a free sample or call us at 1-866-865-6101. That's 1-866-865-6101. We're here to help. Welcome to Life Without Leaks, a podcast by the National Association for Continence. NAFC is America's leading advocate for people with bladder and bowel conditions, with resources, connections to doctors, and a welcoming community of patients, physicians, and caregivers, all available at nafc.org. Welcome back to another episode of Life Without Leaks. I'm your host, Bruce Cassover, and joining us, as always, is Sarah Jenkins, the Executive Director for the National Association for Continence. Welcome, Sarah.
Thanks, Bruce. It's great to be here.
Yeah, I'm excited because today we're going to be talking with Dave, who is a patient who is going to share with us his prostate cancer journey, about how he discovered that he had the condition and what he did to treat it and how he's doing today. So, Dave, thank you for joining us today.
Well, thank you, Bruce, and I'm pleased to be able to share my experience with our friends who may be watching this podcast.
Yeah, it's unfortunate that you had to go through this experience to be able to share it, but we do really appreciate the fact, because this is a condition that a lot of men have to face, and a lot of men aren't expecting that they're going to have to face it. And a lot of what happens when you find that you have prostate cancer, and the treatments and the aftermath comes as a surprise to people. So I hope that there's a lot that they can learn from this. But before we even get going, maybe you want to just tell us a little bit about yourself, who you are, your background, and, your life in general before you discovered that you had this condition.
Well, certainly. Thank you. I'm retired. I spent a career in medical practice management. That was accidental. I was in public accounting as a CPA, auditor, taxes and stuff, with a number of different clients and industries. And then I picked up a new client, which was a pathology practice, and it was taking more and more of my time, and I ended up taking a full-time position with that practice. While I was doing that, I decided to do a law degree on the side part-time. Not that I wanted to practice as an attorney, but just to have one more tool in my toolbox. After I completed that, then I ended up in anesthesia practice management, and that was where the bulk of my career was. So I do have although I'm not trained in healthcare, I do have a pretty decent understanding about the pathology and anesthesia. And one of the doctors that I had worked with and related to what I was doing was a urologist who I'd grown to be friends with over the many years, and had referred patients to him, friends who had, maybe a kidney stone or something like that, and including my brother, who, like 10 years ago, ended up with prostate cancer. And I said, you need to go see this guy. And he ended up going with him, and he did have the cancer and did the radiation, and it was successful. However, because I was older than him, he kind of started following me to, just to be on the watch for cancer, from the familial aspect, or potentially familial aspect of prostate cancer. And about 8 or 10 years ago or so, I had prostatitis, and with an elevated PSA, which eventually was controlled, but he ended up doing a biopsy, and there was some caution, but no cancer at that point. And I continued on an annual basis with him and doing the PSAs and stuff, which were, fairly within normal limits, until the fall of 23, and it was elevated, and that had some concern. And by that point, they had a new process where you could do an MRI and match that with a biopsy, and that gives much better information in terms of how to approach, a cancer situation. And so, working with my urologist and his partner and 2 independent radiation oncologists, it was determined the best approach for my situation would be going the radiation route. As any listeners would know, there's many tools that a pathologist could do, including watchful waiting, essentially nothing. They could do the surgery, they could do brachytherapy, you could do the radiation, and I think maybe there's a couple other things. There's a freezing thing, I think the cryosurgery that I've heard is some too. But in analyzing it all four doctors for me recommended the radiation, largely because I was in the range where it's highly treatable. It's a little bit more than doing nothing, watchful waiting, based on my age, but it certainly was not a highly serious thing where maybe the removal would be best, because you certainly want to do something so it doesn't metastasize and then you end up with a worse problem. So with this February of 24, did the 45 days of radiation, which it becomes almost like a job. You go in every day. You need to drink a lot of fluid beforehand, because for the radiation to be the most effective, you need to have the bladder full. Now that, of course, makes for an interesting situation, because it was a 30-minute drive to the facility. So you got to be drinking a lot, and then you got to wait for your turn to get zapped by the machine. They don't tell you that much beforehand, about the, potential side effects. But I noticed that, every week when you meet with the nurse and or the doctor, they ask if you have any side effects with respect to urinary or bowel or anything else. And I was noticing urgency with the urine. Of course, could expect that when you're drinking a lot of fluids and you're supposed to continue drinking a lot during the day. It's supposed to help reduce the irritant that can affect, the urethra, the bladder, and around also for bowel movements. And then I was experiencing some urgent accidents and an occasional diarrhea. And so I decided to start wearing pull-ups to be safe, and the nurse was totally supportive of that. I was surprised that they did not mention it that much beforehand, but they certainly must expect it because you were asking it each week. I wrapped up the radiation good. The PSAs, it had been low the past year. The incontinence was decreasing to relatively infrequent. Some, of course, you still have to continue drinking the heavy fluids, water during the day and stuff. Some night issues. And a number of months ago, I ended up with some swelling in my right testicular area. And I thought, well, that's kind of weird. But I noticed I was kind of sluggish and wasn't getting the yard work done as quick as I would have liked or that my wife was expecting. And then I finally, confessed to her what the situation was. And I said I was planning on calling the urologist the next day. And she said, don't wait. And we were in the middle of a musical theater production that was at the break. And she said, text him now. And so I texted him what the situation was, and he said, come into my office tomorrow morning. So the next day was a Monday, and I just showed up without an appointment. And he diagnosed it right away as epididymitis, which is the epididymis is the tube along the testicle, and it can sometimes get infected. If you're a young man, it's most likely an STD. Fortunately, that wasn't my situation, but it probably was. He felt a backflow of urine, and that can happen in older men. It can happen if you've got prostate issue or prostatitis or something like that. And so he put me on antibiotic, and it reduced it some, but it not resolved. And so then he did a second antibiotic, and that was over the course of a couple months to at least anatomically get back to normal. So that's where I am right now, and I'll be going back, I think, in another week or two for a PSA update, and hopefully that will remain in the very low score.
So what is the radiation process like? Is it painful?
That's a good question. It is not painful at all. You may be scheduled anywhere from 12 visits up to 45 visits. And there's all sorts of calculus that's done usually by a physics person who works with the radiation oncologist to calculate out exactly what and where and the type of dosage that you're going to need. Doing more days, then you can use a a little bit lower dosage, and that creates a little less issues and havoc in the other areas nearby where they're trying to treat the cancer. The higher dosages can have perhaps greater side effects. So I think what they did for me was stretch it out and have that be a little safer, although then it causes you to make more trips. But once it goes quickly and once it's done, but you're in for anywhere from 30 to 45 minutes once you walk in the door to when you walk out. And you go in, you lie down on the table, they have you pull your pants down, but they're not really looking, and they put a little sheet over your private areas, and they make sure that you're lined up, and there's 3 lasers because you have little tattoos on you, and that makes sure that you're in the exact spot at any time, and they'll adjust the bed accordingly. And then they do take an ultrasound picture so that it all is checked. And there's also significant computer programs and functions that you verify that you are you and they're not somebody else. And so you get your personal menu of what's getting zapped and how strong it is. And it takes, maybe 5 to 7 minutes as the machine rotates around and it gets it from different angles. And you obviously want to hold still. They could tell if you're going to cough or something, and they don't push the button to your back still. And then they'll say, okay, all done. And you get up, and usually you run to the bathroom afterwards and then head out.
And you get a tattoo, which is cool.
Well, they're little tiny red dots that you can hardly see them.
I thought you get a big panther or something. That would be cool.
Yeah, maybe the next time.
Hopefully there's no next time. So how do you feel moving forward? What do you think your prognosis looks like then?
Well, I would say differentiating this from, as I've read more, if you have the total prostate removal, you can have, potentially a lot more dysfunction, and you're probably worse off in the beginning. You need to do your pelvic exercises and stuff, but you're going to more probably be in a diaper because you're not going to have any control at all versus being able to use a pull-up or something like that. And then that'll gradually get better. For my situation, the incontinence was more infrequent than regular, and it, could vary depending on, am I drinking enough fluids? Almost all medical professionals, my internist as well as urologists and stuff, say you need to drink plenty of fluids because that reduces the irritants, that can cause the incontinence. So that all kind of makes sense. So as long as it doesn't get worse and, gradually continues to decrease, then I'll be fine. It doesn't really interrupt my daily life or anything. Went on, our trip that I mentioned before the start of the podcast and had no bad experiences, but I was protected from any embarrassment if I would have.
It's really interesting because, when we've spoken with patients before who've had prostate removal surgery, then, incontinence is, they say, is something that's going to happen to virtually every man who experiences it. It's just, it sort of goes hand in hand. But we have not had a lot of patient conversations about incontinence associated with radiation treatment. So it's really interesting and enlightening to hear the sort of experience you had. And I'm wondering, you said that it was came as a bit of a surprise to you, even though the questions that you were asked sort of made you think that, they were expecting that this was a real possibility. Were you sort of really taken by surprise?
Yes, it wasn't that much, given in advance, but I think that it occurs with some greater frequency than what, they generally tell in advance. Now, is that because they much rather have the person get the radiation, take care of the cancer, and beware of some, have some side effects, but the side effects are better than having a metastasis? That certainly is a better result, and that's the way I looked at it. But when I read some of the medical journals and reporting, and of course, it's kind of hard to tell exactly, how accurate, reporting can be from patients or how the information is collected, whether it's in surveys or, the nurses, compiling data or something like that. There was one England report that showed for on the radiation, there sometimes could be as high as maybe a 40% rate of men who experience some incontinence after the radiation. Certainly in other things I've read, it's, maybe closer to 10%. Most of it will subside as the farther away you get from the radiation, but there'll still be some percentage that seems to be a little longer lasting, with a few going beyond a year or so. I think mine stretched out further because I happened to get the unrelated infection that causes the exact same symptoms. So I think it's a combination of, you need to give patients, appropriate notice of, all the major things, and yet, you can't hit them with everything or they'd be afraid to have any procedure done. And anytime you do a procedure, even if it's a blood draw, there's always a risk of some unintended consequence. So for me, it was still a, decent trade-off.
I can imagine, and certainly when the doctor starts talking to you about cancer, that it's probably hard to keep everything in your mind anyway. So, adding on, and then there's this possibility of this and the possibility of that. There's just a lot of information to hold on to. So it's not a surprise to hear you describe that. Now, I'm also wondering, you talked about how you really got some benefit out of using absorbent products. But you also mentioned in passing something about pelvic floor exercises. And I'm wondering if you can tell us a little bit about whether or not you've been able to sort of keep a routine of those faithfully, and if so, if it looks like it's had any benefit for you as well.
I did do the Kegels exercises during the radiation treatments. It seemed like a good idea at the time. I think I kind of gradually got away from that. I think they're more useful during the post-radical period for a patient than for the radiation patient. But I think, that should be, it probably doesn't hurt to do them, but let the doctor and the nurse recommend what's best for each particular patient's case. Certainly no harm in doing them, I don't think, but I probably could have done it more, but I should probably exercise more too. So.
Yeah, you're not the only person who said that, that's for sure. So Dave, I want to ask you a bit of a personal question also, so apologies, but can you tell us, did your procedure, your treatment, was there any effect on sexual function or anything related to intimacy that might be worth, making other potential patients aware of?
Yes, that certainly does come with it. And a couple months after the radiation had been completed, I was discussing with the urologist both the erection aspects and the incontinence aspects. And so he put me on 3 meds. I didn't start them all right away because if you had a reaction, you started all 3 at the same time. You know which one, was disagreeing with you maybe. So there's the sildenafil, which is kind of a Viagra equivalent to help with the intimacy aspect. And then also finasteride and tamsulosin. I'm pronouncing that correctly. So those 2, and one ironically can help with hair growth, which I could use a little bit of help on anyways. But those 2 together are supposed to help with the urgency and stuff. It did create a little bit of excitement from the pharmacist people because they got, notices, watch this video and look out for these different side effects and stuff when you're doing in the combination with the Viagra equivalent. But the doctor uses the same 3 himself, he claims. So I guess the assumption would be it hasn't totally eliminated all the issues, but, would it be worse if I wasn't doing any meds? That's always the possibility too. And of course, with the prostate sustaining all of the radiation and stuff, you don't get as much production of the ejaculate that would go along. So that's going to be, different. But yes, I deal with that, but, it's very tolerable.
Well, that brings up an even more important question. And, we're talking about some things that are very hard for a lot of people to talk about. We're talking about things like sexual function and incontinence and, all sorts of pelvic health issues, things that people don't just want to talk about, but really, are related directly to the sense of self. And I'm wondering, can you talk a little bit about, your mental health as you've gone through the whole process and how you manage to sustain yourself from a mental aspect as you've gone through things?
Yeah, I think that's a good question to ask. And I think in part I've been, to me, it was almost like an interesting learning experience. I'd had two or three rather unusual medical events over my life. One was this was back in the early 90s. I had a benign vascularized tumor on a kidney that spontaneously just bled out. I thought like I had a back spasm or something like that. And it turned out it was a heavily vascularized growth that caused it to bleed. Fortunately, it kind of filled up the compartment there. Within our body, there's different compartments, which is a good thing because then you don't just, the bleeding eventually stopped, but they had to go in and take it out. Unfortunately, it was negative. But it was quite an experience of having to get units of blood and having a surgery then and stuff. And then a couple of years later, I actually observed the surgery, and it was quite fascinating if you ever had the opportunity to, be in an OR where there's this wasn't done laparoscopically. It's, totally open in the kidneys there. You could see the lung, you see the arteries. And in fact, I was standing in the corner and the surgeon said, "No, come on, look over my shoulder." And it was fascinating as he excised the tumor, and then he folded the kidney up like a book and stitched it closed, sent the specimen to pathology. And so then I knew exactly, what I had gone through with it. Then I didn't really have anything else that significant until this. But with my brother having had his radiation and prostate, I kind of knew somewhat what I was getting into. Once you do it, you find out how many other friends or friends of friends that have gone through the same thing. And I don't think, what I went through mentally was any worse than, other people had a lot harder with other significant comorbidity issues and stuff. So I had the advantage of, strong family, supportive wife and kids and stuff. And I didn't advertise what I had, but I didn't keep it a secret too, and, shared with my Sunday school class that I teach. And so collectively, it's your doctors and professionals and family and friends to get through the things.
Well, I'm glad to hear that you had that perspective and that sort of helped you manage. And I also guess that, being somebody who worked so closely with, with everybody in the medical field probably made you a little more comfortable to some of the things that you were experiencing also. But I'm wondering now, one of the things that we always like to leave our listeners with is a little hint or a tip or a bit of advice to help them live a life without leaks. And, you certainly have a wealth of knowledge that you've earned not easily over the past few years. I'm wondering if maybe you might have any bit of advice or a strategy that you can share with our listeners as well.
Well, you certainly want to, while you're going through the radiation process, you want to do everything that they advise you to do, particularly drinking the fluids. I guess I was successful at drinking enough each day because they didn't postpone zapping me. They actually do a quick ultrasound to make sure you have enough urine in your bladder that that day's radiation will be effective. So that's a good thing, I guess. But also, diet and continuing, fluids during the whole day. I think my doctor would like me to drink 120 ounces a day of water. That can be kind of hard to hit. I probably get 90 anyways with it. And the other thing, I probably could cut off fluids sooner at night than I do, which would help with some of the either nocturia or enuresis. But, I still want to get my fluids in.
Well, here's hoping for continued improvement for you and, just wish you well in your ongoing recovery. And I really want to thank you for sharing your experience and your insight and your advice with everybody who's listening to us today. We have an enormous number of men who visit nafc.org who are just beginning their journey, who know nothing about what lies ahead for them. And your advice today is really going to be illuminating. So thank you for sharing with us.
Life Without Leaks has been brought to you by the National Association for Continence. Our music is Rainbows by Kevin MacLeod. More information about NAFC is available online at nafc.org.
If you look at the numbers behind incontinence in women, it's hard to believe just how big an issue it is. Incontinence affects more women than diabetes, breast cancer, and heart disease, but it doesn't get nearly the attention it deserves. That's why the National Association for Continence has created the We Count campaign to help you realize that this isn't just a you problem, it's an us problem. There are treatments available right now that can make a real difference in your life, and we invite you to take action today. Visit nafc.org/we-count for essential facts, insights, and resources on stress and urge incontinence, overactive bladder, menopause-related leakage, and more. That's nafc.org/we-count to learn more and discover that there truly is strength in numbers.